Hi, I'm Nate, a doctor specializing in obstetrics. One of the first big decisions a mother makes is how should she feed her child, or children. The second big decision is of course whether you should name your baby son Nate. If you haven't done so, subscribe to this channel and give this video a like. Should you breastfeed, or is bottle feeding a better option? In most circumstances, we encourage breastfeeding for the first 6 months of life, as it comes with lots of benefits for both the woman and the baby. Breast milk provides babies with a well-balanced, nutritious meal, which is easier for them to digest, thus causing less gas and colic, and they're less likely to suffer with constipation or diarrhea. They're also less prone to nappy rash. Antibodies, which help babies fight off infections, is also transferred through breast milk. It also reduces the risk of cot death. Babies tend to gravitate to breast milk, whereas it may require some time for them to take to the taste of formula. It also reduces the risk of obesity, diabetes, and severe eczema in later life. Children who were breastfed were also found to score higher in schools. For mothers, breastfeeding helps with the initial breast engorgement, which occurs around the 3rd or 4th day after birth and can be uncomfortable. It helps to lower the risk of postnatal depression. Breastfeeding also helps to lower the lifetime risk of breast and ovarian cancer, osteoporosis, diabetes, and obesity in later life. Women who exclusively breastfeed for the first 6 months of life also enjoy a natural birth control method, which is up to 98% effective. From a practical viewpoint, breastfeeding, for the most part, is free and makes night feeds simpler. And if pumping or expressing allows for some freedom away from the baby, giving your partner a chance to participate with feeding while still providing breast milk to the baby. Nevertheless, breastfeeding can cause problems which are unpleasant. Firstly, it can lead to sore nipples, especially in the first few weeks of breastfeeding. This is likelier with suboptimal feeding techniques or positioning. Therefore, changing the feeding position will help improve this problem. To combat dryness, which can perpetuate soreness, ointments containing lanolin can be helpful, as can olive oil or expressing. This initial pain will improve after 7 to 10 days. The breasts can be engorged, making them feel hard, swollen, and painful. This is caused by a blockage of the milk duct. To minimize this, we encourage mothers to nurse at least 8 times over a 24-hour period for at least 15 minutes on each side. Espressing and the use of hot then cold compressors can also alleviate the swelling. Breastfeeding can also increase the chance of an infection of the breast, which we call mastitis. This is likelier with breasts which are engorged. It typically occurs on one side, and the breast may appear red and tender and will require treatment with antibiotics. For mothers with mastitis, we generally still encourage breastfeeding, as this can help with symptoms and is not thought to be harmful to the baby. Another big factor to consider is public breastfeeding. Although society has come a long way with how breastfeeding is viewed, with both public and private institutions affording spaces for mothers to nurse, there will still be times when mothers encounter strangers with a negative attitude towards breastfeeding in public. Of course, bottle feeding has its benefits, namely because breastfeeding can be difficult, especially at the start, particularly for first-time mums, though you will receive help if you are struggling. Breastfeeding can also be a hassle and is tiring, especially when the baby's having to feed on demand, and so bottle feeding allows for easier delegation of the workload. And of course, many will decide to have a mix of both breastfeeding and bottle feeding with or without formula, and how often families decide to feed with each method will change as the baby grows. When the child is born, we encourage feeding to occur as early as possible, especially for babies born to mothers with diabetes, as this helps to maintain normal blood sugar levels for the baby. For the first few weeks of life, we advise for the baby to be fed whenever they appear hungry. When the child is hungry, they may appear restless or start making murmuring sounds, sucking their fingers or rooting. It is almost impossible to overfeed a baby that's exclusively breastfed. During the first few days after birth, the milk produced is called colostrum and can appear thicker and yellower. Feeding babies colostrum is hugely beneficial as it contains a wide range of stuff, including antibodies, which can help fight off infections, especially when the baby's immune system is still developing. It also helps with the development of baby's digestive system and encourages them to pass their first poo, which helps prevent early jaundice. The production of colostrum starts even before the baby is born, and so harvesting colostrum before childbirth can be beneficial. However, there are reasons we would advise against expressing colostrum during the pregnancy, namely if there is a risk factor for preterm birth. For women who are breastfeeding, we advise continuing with vitamin D supplements, as breast milk tends to be deficient in vitamin D. Women who've had previous breast augmentation surgery can still breastfeed, but may find it more difficult supplying adequate amounts of milk. Babies who are extremely premature at birth may require specific types of formula, as breast milk may not be adequate. However, your doctors and midwives will guide and support you during this journey and will take your feeding preferences into account and provide recommendations. In the UK, we recommend women living with HIV to use formula milk. Nevertheless, if they wish to breastfeed, we can take precautions to help minimize the risk of transmission. We may also advise against breastfeeding temporarily with certain infections or whilst taking certain medications. Always discuss with your doctor when starting on a medication. Although drinking is safe, alcohol can transfer through the breast milk. Therefore, we advise waiting for a few hours before nursing. Feeding is never easy, if only babies are like the Cookie Monster. Regardless of how you wish to feed, your midwife, health visitor, lactation consultant can teach, guide, and support you. I hope this has been helpful. I've only scratched the surface as there's so much to talk about when it comes to feeding. I've included a few links below. Share, subscribe, and I'll see you again soon.